Health is the premier health delivery system within the Twin Cities of Minnesota. We have 13 hospitals, 65 clinics, and serve a wide variety of patients from the inner city out to the suburbs, and provide tertiary and quaternary level care throughout every specialty of medicine.
Physician happiness is incredibly important to the way the patients feel taken care of, which, I mean, that really gets to the bottom line of what we're trying to provide. So if a physician is burned out, they're not going to be working at 100%. The patient's definitely going to feel that. And then, we might lose the physician if it gets too bad.
EMR, for better or worse, has become sort of the symbol of burnout, and so making our EMR as efficient as possible is a top priority, and also customizing the EMR as much as possible for individuals has been a top priority. There's an immense amount of user data that comes out of Epic in the form of the PEP data, and this comes in a way that we were looking to really optimize our utilization of that data and make it as user-friendly on an individual level as possible.
What Nordic helped us to do is to take the raw data from that and operationalize it using a dashboard, so we could see it trended over time. We could use it more dynamically. We could focus in on a provider or pull out and focus on the organization, a specialty, or a department.
And we sort of brainstormed what the best information would be to display within the dashboard. And that process was iterative, so we had a series of dashboards that came through, and we built upon each one to reach what's the end product and what I think is a really fantastic tool. I was really pleasantly surprised and really impressed with the usability and with the overall interface of the dashboard.
The goal of the Performance Support Program is to help providers and clinical staff with their use of Epic, whether it's creating speed buttons or showing them efficient ways to search in the chart. Those are all tools that will save them time in Epic and help them focus more on patient care. Prior to CPED, performance support trainers would meet with providers who were willing to meet with us, who felt like they were struggling, who felt like they would need help. But now with using the CPED data, we're able to look at a specific clinic and look at the providers and identify who might need help, who has a lower efficiency score, who's spending a lot of time documenting. And absolutely, the CPED data is helping us identify providers that we may have never met with, that have been maybe flying under the radar and not speaking up that they want help from a performance support trainer.
So if I only have a couple minutes to walk by and give them some tips and tricks on the system, I know exactly what tools I can pinpoint on when I have their attention for maybe 5 minutes or so. The total time saved by the providers was 3 minutes and 8 seconds per patient, and a provider can see an average of 24 patients a day.
My experience with Nordic was fantastic.
I thought we had a really great partnership. Nordic was always there to answer our questions.
There's a lot of sticking to timelines, so I really appreciated that.
The level of expertise in this area in particular, creating the dashboard, I was absolutely blown away.
Coming in on or over budget is sometimes problematic, and with Nordic they're really coming in where they estimated or a little under, which was great for everybody involved and having a great working relationship.
So anytime I had a question, I would throw an email or a phone call their way, and I immediately got a response. And I definitely felt like I was being listened to, that my feedback was important, and the whole experience was great. I would definitely want to work with them again.